Good morning, everyone. Welcome back to another episode of the Wilderness Fitness Podcast. I'm your host this morning, Dr. Rob Minturn, owner and founder of the Wilderness Fitness Institute. Today, we're going to be talking about type 2 diabetes and pack dumping, the management of your type 2 diabetes. Or this will be if you don't have type 2 diabetes. This is a great way to look at preventing type 2 diabetes as well. All right. So first, I want to talk about what type 2 diabetes actually is. So it is insulin resistance with the tissues. It is not inherited. And we talk about insulin resistance with the tissues. So basically, when you eat, especially a carbohydrate meal, your pancreas releases insulin, which helps break down the blood glucose that is floating in your arteries and your bloodstream. When the tissues become resistant to that insulin response, the bloodstream or the blood glucose is not reabsorbed into the tissues as easily and as readily. So that creates a more acidic environment in the bloodstream. So because there's more floating blood glucose. You want that because that's quick energy, but too much of it can create an issue, right? Think of a roadside drain. When it rains, if there's no plug in the drain, there's no leaves in front of the drains are going to be able to handle all the water coming down the street. If there's any sort of blockage in the drain or the drain is blocked off for whatever reason, not as much water is going to absorb into that drain. So then it continues on down the street, hopefully to be absorbed to the next thing, but the next thing's plugged up. So it just keeps going down the street and it stays in the road. It doesn't veer off and get drained properly. It's similar result with the blood sugar levels, with the blood glucose in someone with type 1 and type 2 diabetes. But type 2 diabetes, more the insulin resistance, right? Type 1 folks just don't produce insulin. Their pancreas just stops working. Okay. Second thing to note of what it is not, I can't remember if I said this or not, but it is not inherited. Type 2 diabetes is more of the lifestyle diabetes. So that's why I really wanted to talk about it today. Why is this important? So I touched on it earlier. Why is managing your type 2 diabetes important, or why is it important to prevent type 2 diabetes from happening in the first place? One, it's happening in kids. I touched on this. I did a podcast last week with a dietitian, Kyle Camp. And if you guys are not following Valley Peak Nutrition, be sure to follow him on Instagram. Check out his resources in his podcast. But him and I did a podcast last week that will be released this fall, and we talked about kids and eating was one of the topics. So we're seeing type 2 diabetes and childhood obesity happening younger and younger and younger. We're getting more sedentary and more sedentary. So that is a problem, right? Type 2 diabetes used to be something that happened later on in life, but now we're seeing it at all age lifespans. Multiple reasons for that. It's not something that we can just simply say, hey, eat better. We'll touch on that in a little bit with the nutrition. But we're seeing it in younger and younger folks as well. So it's not just as we get older anymore. But when we have too much blood sugar floating around in our arteries, it's going to create a more acidic environment in our tissues. Why is that a bad thing? Well, our body likes to be in what's called homeostasis. So our body likes to be at a certain pH, a certain acidity within the bloodstream. We have a certain range. We have buoys with our blood acidity that we function well in, right? There's a range because the body is, some people function maybe a little bit better, some people function a little bit lower or better at a lower pH, a little bit higher pH, but it's a very small range of a pH, right? And the range is there just to safeguard because it's the human body. We can't be at one strict thing every single time. Um, so what happens when we have too much acidity or too much blood glucose? We get that acidity in the blood. It creates a poor environment for our tissues. Our kidneys and our lungs are responsible for regulating our pH in our bloodstream. So that's why when you start working out, you start like our lungs act quicker at regulating the blood acidity, right? So when you start working out, you start huffing and puffing, you're working really hard. You're creating a more acidic environment in the blood so that you breathe harder to absorb or to get more oxygen into your system and load it onto your arteries to deliver that blood and the oxygen to reduce that pH. The kidneys act a little bit slower, so it's more of it's kind of like a long-term investment, right? Versus playing the lottery, you're going to get a quick reward if you win. That's the lungs. The long-term investment, like your 401ks, your Roths, that sort of investing yourself, is going to be more of the kidneys acting on your blood sugar levels. So they act in different ways, but those are the two main regulators of our blood pH. Um, So with that, with higher pH levels, with the blood glucose floating around, you're gonna have that poor healing ability. Wounds aren't gonna heal as well. You're not gonna heal as well from injury. Again, it's not a great environment for that stuff to happen. You can develop nerve issues. Again, this is gonna be later on in life, but you're gonna develop nerve issues like eyesight, neuropathies, and that can lead to amputations. If you can't feel your foot, you develop a wound on your foot from hiking around in the mountains. You're thinking, oh, my toes are numb. Like, what's the big deal, right? And when you're young, it is a big deal, but you can get away with it. When you're older, you might be hiking too much, develop a blister. You didn't know it because you couldn't feel it. Well, you keep hiking, you don't change your socks or it gets dirty. Well, now your toe's infected. Now you got gangrene, and now you have to get that thing amputated. If it's your big toe has a ton to do with your balance. Anybody that's lost a big toe, soldiers or anybody that's been in an accident that's lost just their big toe, they see how big it is in terms of balance. So that can be an issue, right? Amputations, just because it is a toe, like it's a small part of your body, but it's a very large role. Um, your kidneys, right? Your kidneys are responsible for helping regulate the pH in the blood. But folks with type 2 diabetes or even type 1 diabetes with things going unregulated, you might have a higher, or you will have a need for dialysis if you're not taking care of yourself because it's hard on the kidneys to regulate the blood acidity, right? And then the cost, and this was the most eye-opening thing for me. I got some of these stats from a book that I'm reading currently, but the cost for the average patient dealing with type 2 diabetes is $85,000. If you have a diagnosis of type 2 diabetes, you're going to have higher insurance premiums. And it actually takes 10 years off your average lifespan as well. So it's something that you really don't want to deal with. Prevent it as best you can. But if you've got it, there's certainly ways that you can go about managing that as well and hopefully getting off of the medications that you're on. Um, and let's talk about those a little bit. Again, it's not inherited. You inherit lifestyle factors, you inherit lifestyle habits. You don't inherit type 2 diabetes. So I'm going to order these in what I think is the most important and in terms of least importance. So they're all important, but I think sleep is the number one reason, or is the number one modifiable risk factor, or whatever you want to call it, modifiable lifestyle factor that someone can modify to improve their blood sugars. Nutrition, and then we've got exercise. So we're going to unpack each one of these a little bit. So let's go back to sleep. Sleep, the correlation doesn't always equal causation, right? But there was a correlative study done on folks that they had higher risk or higher rates of type 2 diabetes with folks with less than 6 hours of sleep. So that was a research study that, they looked at folks that had type 2 diabetes, and then they asked how much sleep are you getting on a consistent basis. And those with getting less than 6 hours of sleep, they had higher rates. Okay. Um, so that panel of research then led to more research being done. And so this research was done on folks that were healthy. They had no issues with blood sugar levels. They had no type 2 diabetes, really no comorbidities to any regard. Relatively were healthy individuals overall, right? They had them go with 6 nights of sleep of less than 4 hours. And at the end of those 6 nights, the participants were 40% less effective at absorbing blood glucose compared to when they were getting their 7.5 hours of sleep. So, what does that mean? Like, say they had a doctor's appointment, they have a big business meeting coming up, they're staying up late at night to get the the presentation done, all that stuff, and they're getting less than 6 hours of sleep. Um, or sorry, 4 hours of sleep that night or for that week. And then they have a doctor's appointment that following week, like on Monday or so. It's going to be an issue. Like they're going to have their blood test is going to show that they are pre-diabetic or maybe even like they are diabetic, right? So the doctor then is like, well, you've got prediabetes or you might have type 2 diabetes. Let's take a look at let's modify some things. Hopefully this is the case, but let's modify some things and not get you on medication. Some doctors might even say, let's get like the blood sugars might be so much such that they are like, we need to get you medicated, right? And all because you had those 6 nights in a row of less than 4 hours of sleep, or even less sleep. There's research done that's got folks sleeping closer to the 6 hours or closer, like 5 hours or 6 hours. And similar results are being shown that when you're getting less than 7.5 hours, your blood sugar regulation is not that great. Your ability to reabsorb that blood glucose after you eat is impaired. To the degree of impairment, it just depends on the individual, right? But making sure that you're getting the right amount of sleep helps regulate your blood sugars. Okay. So you might have type 2 diabetes, or you've been to the doctor and you're pre-diabetic and you've been told to get more sleep. Like all of my patients that have type 2 diabetes are like, well, you need to eat better or you need to get more sleep. Sweet. So what the hell does that even mean, right? Like you need to get more sleep, but how do you go about doing that? You've got to improve your sleep hygiene. Um, a circadian or sleep cycles are about an hour and 15 minutes to an hour and a half. So if there was anything, if there are two things that I could tell someone like you've got to do this to improve your sleep hygiene, it's one, go to bed at the same exact time every night and wake up at the same time every morning. If you're someone that works very early in the morning, it's going to suck, but going to bed at the same time on the weekends or when on your days off and then waking up at that time, it's going to improve your body's efficiency to get the sleep cycles done in the time allotted for your sleep. Now, if you're constantly in a sleep deprived state, right, you're getting less than 7.5 hours of sleep during your working week, maybe tacking on an extra hour and a half of sleep onto your alarm for the days that you're off would be a good idea. But if you're getting the correct amount of sleep during your working week, and it should be a priority for you to do that. You want to wake up at the same time, go to bed at the same time and wake up at the same time every single day. Okay. And then a cool room, 62 to 68 degrees or 69 degrees is the ideal ambient air temperature. It's kind of tough here where I'm at in Alaska. No one has air conditioning. There's not a huge need for it because it stays relatively cool. But it does get warm. There's been a couple times it's been at like 70 degrees, 72, 73 degrees in the apartment when I go to bed. So it takes me a little bit longer to fall asleep because my body temp is not cooling down. But those would be the two things: cooler room down, and then same wake up or same bedtime, same wake up time. Okay. Another thing that I've run into, and it's been a lot over the years, but it's not been something that I've been great at addressing. But now I feel a little bit more comfortable addressing it now after reading some books and further educating myself on it. But the nightcap, the alcohol nightcap, you have a shot of whiskey, like a glass of whiskey, maybe a glass of wine with dinner or before bed, just to help you calm down, to help you fall asleep. Alcohol is a sedative. Out of wakefulness, it does not put you to sleep, right? So it is simply sedation. It is not actually sleep. It mimics that of light anesthesia. So you're not actually sleeping well when you go have surgery of any kind and you're under anesthesia. I joke about it with patients and say, enjoy your nap, but it's really not a restful nap, right? So alcohol does the same thing to that, or as light anesthesia. And there are two reasons why alcohol is not great for sleep quality. Yes, you like fall asleep and like you seem to stay asleep, but you really don't. It fragments your sleep to the point where you're going to wake up multiple times a night, but you're not going to remember those wake ups, right? You're going to wake up and then fall right back asleep, wake up, fall back asleep. Like it's so minor that you actually never open your eyes. You never actually become conscious of the fact that you're awake. But when that happens, it suppresses REM sleep. And it's doing this for the first half of your night or the first 2/3 of your night, right? So if you're thinking, or if you're sleeping 8 hours, the first 4 to 6 hours are of you not getting great sleep. So that's leaving you maybe 2 to 4 hours of getting decent sleep, and that's saying that you're getting 8 hours of sleep. So sleep is something that we should be doing a third of our life. Alcohol has a huge impact on that. Even one drink can affect your body's ability to get into that REM sleep. It's going to create that fragmented sleep because your body has to deal with the alcohol first. Alcohol is simply a poison. There's very few, if any, true benefits to drinking alcohol, especially as a nightcap to help you fall asleep. Okay. Um, Nutrition wise, so that's enough on sleep. Nutrition wise, like I said before, you've been told to eat less processed foods. You've been told to eat more fruits and veggies. You've been told all this stuff, but implementing it is another story. Well, how do you implement that? Usually I say the 80-20 rule. Like I tell folks, do like eat well 80% of the time, and then 20% of the time, do what you want with some moderation, right? You can't go buck wild on the weekends and eat like a frat boy. Someone else use that and that phrase in their post today. I saw that today and I laughed. I was not in a frat at all, but I just thought it was very funny that that was the analogy that they used. Um, but use the 80-20 rule. Eat if you can look at the food and you don't know if it swam, walked, or grew from a vine, tree, or plant on this earth, probably don't eat it, right? But if you look at the food and then you can source that back to the to where it came from very easily without a bunch of processing or anything like that, go ahead and eat it. Do that 80% of the time. The other 20% of the time, enjoy yourself. Okay. But again, you cannot go buck wild like a frat boy on the weekends. Okay. And eating carbs is totally fine to do with type 2 diabetes. You need to eat carbs, especially if you're dealing with diabetes and you're exercising. Carbohydrates are going to be the fuel for your exercise. Carbohydrates are going to be the fuel for your hiking activities and all this stuff outside. But you have to be mindful of your carbohydrate intake and the type of carbohydrates you're taking in. This is why I say for the nutrition aspect, if you're not following Valley to Peak Nutrition on Instagram or his podcast or know of him at all, definitely check him out and get some more information on that. Exercise. So exercise has a natural way of reducing blood sugar levels and improving overall insulin sensitivity of the tissues. So you want sensitive tissues to insulin. That's how the body is going. That's basically removing the leaves and the trash and all that stuff from the rain gutters and letting the rain fall down into the gutters and getting off the streets. Our arteries are the streets. The rain gutters are the cells absorbing the insulin and the blood sugar, right? So you want sensitive blood sugar receptors. Um, and so exercise just has a natural way of doing that. One, it burns calories, but we're not really worried about calories with type 2 diabetes. It's more of the blood sugar levels. So exercise just has a natural way of doing that. Um, there's a client that I had in New London when I was working back there a couple months. It's almost been, God, it was last like October, November when I was working with him. And I did not know he was coming in for low back pain. I did not know that he was struggling with type 2 diabetes and blood sugar levels and all that. That never really came up in the history taking. I always ask, is there anything else about you that I need to know before we get started? And that never came up. So, okay. Um, and so he came to me in December and said that he had a blood sugar test and all that stuff because he was on the pre-diabetes route in the type 2 diabetes route. And he said that his A1C had dropped, I think it was zero point 0.6 points. And he hadn't changed his diet at all. The only thing he had changed was he started going to the gym for his home exercise routine 3 times a week. He used to go for COVID, or he used to go before COVID. COVID hit, and it had been 4 years since he had been back. So for his home exercise routine, I was like, dude, just start going to the gym again. Like, do your routine. Let's do the stuff that we got you doing here and see what happens with your back. And in that, his A1C started to drop, and so his primary care was no longer concerned. Like as long as he continued that trajectory, his primary care was no longer concerned of the fact that he was going to be developing type 2 diabetes. So, and that was just 3 times a week for about 45 minutes or so. So exercise has a huge impact on your body's ability to regulate blood sugar, huge impact on blood pressure, cholesterol, all that stuff. But today we're focusing on blood sugars. Um, but yeah, 3 times a week for 30 minutes is the bare minimum. It doesn't take much, right? So clinical bottom line, you inherit lifestyle factors and habits from your parents, from your grandparents, from friends and family. You do not inherit type 2 diabetes from your parents or your family. Okay. If you're on medications, there's a chance that you could reverse what is going on and get off those medications. Something that a lot of folks don't know when they go onto the medications that providers aren't always crystal clear on because of time. But it is something that you can prevent. It's not something that you have to go through if your parents or grandparents went through it. You've just got to look at the lifestyle factors. If you have listened to my podcast, you're going to notice a trend. You just got to take a look at your lifestyle factors and notice what they do. And if they're dealing with all this stuff, then you've got to do kind of the opposite, right? Which is going to feel like a huge change, but it's doable. Um, my suggestion is choose one of the big three that I talked about, your sleep, your nutrition, or your exercise habits, and choose one little nuance of one of those three, and that's what you do for the next 3 weeks. And then after 3 weeks, once you get that habit down, you choose another habit and do that for 3 weeks. And then you do that, you choose another habit, right? You could work like one sleep habit, one nutrition habit, one exercise habit, then go back to sleep habit, nutrition habit, exercise habit. Make baby changes because when you do that for 3 weeks, if you're listening to this podcast now, the day that it drops, you have time to create 9 different changes by the end of the year, right? So that's going to be nine, like 3 aspects of your sleep, 3 aspects of your nutrition, 2 aspects or 3 aspects of your exercise. That's going to change by just the end of the year. Okay. And that can pay huge dividends on your body and your quality of life later on down the road. All right. Um, I will say, if you are to one last like bottom line here, if you are someone that's dealing with this stuff, it's you're listening to this and you're like, shit, this is me. You're not necessarily on the prevention side of things. If you're used to living around like the 160, 180, 200, 240 mark, which I didn't like exercise, we should stop exercise at 200. Like that's a cutoff. Like the blood sugars are a little too high. We need to have them seek out medical attention. But there are people that live at that. If you're that high, if you're not between like the 90 and one, I think it's 90 and 110, if you're not between those numbers, you're gonna feel like shit when you start to drop. And that's one thing to keep in mind. It's kind of like an antibiotic with Lyme disease. Like you start taking the antibiotic soon after you get diagnosed with Lyme's or soon after you're bit. You're going to feel worse because the antibiotic is breaking loose the bacteria. You're going to have this lysis reaction, something that I didn't know until I had Lyme disease last year. Um, but it's the same thing when you start to regulate your blood sugars. Like your body is used to being in this certain range. When you start to change that, your brain is gonna be like, "Whoa, what's going on? We've got to get back to where we were. Where you were was not good. Where you were is what got you to the point that you realize that you have to change. So when you start to change, you're going to feel like shit the first couple, I don't know, first couple days, maybe the week or two. But as you slowly start to drop it down, your body's going to develop a new normal, and then things are going to start feeling good, and you're going to have your blood acidity where it needs to be. So take a look, implement some of these for prevention. If you are on the prevention side of things, implement some of these on the treatment. If you are on the being diagnosed side of things, and then see where that takes you. All right. My only call to action this week is going to be check out the new website. It's been something that's been in the works since freaking November, and it's finally to the point between the move and just going back and forth with logos and website feedback. It's finally to the point where it can be launched. Like I did a soft launch a little bit ago, but go check it out. It's cool. It looks professionally done. It is professionally done. Corey did a fantastic job and was super accommodating for what I'm looking for and for I felt like I was being needed, but he didn't seem too frustrated with me. So that's good. It was good to hear. But yeah, check out the new website. That'll be linked in the show notes. And then you guys have a fantastic Thursday, and we'll catch you next week. Peace.